Hello, everybody. My name is Evelyn Coleman, and I am a nurse at the VA Healthcare. Um, my practicum was actually at one of the VA Healthcare's site. Is at one of the CBOCs, and CBOCs is short for Community Based Outpatient Clinic. This clinic that I did my practicum at is located in St. Charles, Missouri. Um, the outpatient clinics work a little bit different than what you will see in the private sector. So each CBOC has multiple providers, and a provider can be a doctor or a nurse practitioner. So each doctor have their own team, and a team consists of a nurse practitioner or a doctor with a RN, an LPN, and an MSA. An MSA is a medical support assistant, and their job is to schedule appointments for their whole team. Now, each team patient load can be anywhere from 500 to 1,000 patients. So that's a pretty big caseload. So my topic is Veterans Video Connect Blood Pressure Monitoring and Education. You will hear me say VVC throughout the video, and I will be referring to the Veterans Video Connect. And that's just a way for patients to have an appointment via video. The purpose of my presentation was to implement the VVC blood pressure monitoring and education at the CBOC location in St. Charles. The reason why they wanted to implement this is because the organization set a goal for patients to maintain a systolic blood pressure of less than 140 and a diastolic blood pressure of less than 80. And so they want each team to be at 74%. So that if you have 500 patients versus 100 patients, that kind of fluctuate in numbers as to how much of your patient load is 74%. The clinic actually, as a whole, they surpassed the 74% mark. They're currently at 79%. But there was one particular team, Team 1, that fluctuated between 65% and 68%. So they fell below that 74% mark. And that was partly due because they didn't have an RN for several months. By the time I got there, they were actually short 2 RNs. So my part in the presentation was to educate the staff on why VVC was being implemented, educate them on how to use VVC and how to access it, and how to get the information to the patient so they can have access to the VVC. My job was to educate them on parameters of the blood pressure, how to educate the patient on taking their blood pressure correctly, and identifying the RN, the LPN, and the doctor's scope of practice, and also providing some preventative measures to some barriers they may come across. One bit of information that I found out that was really helpful is it's the program. The VA has a program, and I forgot the name of it, but it's a program that helps veterans, that enables veterans to access the VVC. So if a doctor comes across a patient who does not have an electronic device or internet to connect, The provider can put in a referral, and that will enable the patients to receive an electronic device, and the VA will pay for their internet connection. So the VA will pay for the internet connection and an electronic device for patients to be able to participate in this VVC program. I thought that was really, really helpful. So some of my objectives were very similar. I addressed the do's and don'ts of VVC. I went over blood pressure, the blood pressure parameters, and how to take blood pressure correctly. I went over the scope of practice for each discipline, and I went over barriers and preventative measures that they can use for patients. Some of the handouts I used the blood pressure guidelines from American Heart Association. I also used a educational tool to help. It was a pamphlet to help educate them on how to use the VVC. I also used a pamphlet called the VA Video Web Guide for Healthcare Providers. And I used 2 articles that addressed monitoring blood pressures in the home. My audience actually consisted of just one LPN. The LPN was part of that team who fell below that 74%. And so I was able to educate her on the VVC and, everything that goes with it. The impact that this project will have on this facility and the patients that come into the facility, or that have a provider at this facility, patients will be able to monitor their blood pressure at home, and they will know how to accurately take their blood pressure, and you'll get a more accurate reading of a blood pressure. So with that information, doctors will be able to monitor their blood pressure more closely and be able to prescribe medications more accurately. The implementation of this project will also contribute to teams 1 percentage increasing from 65% to 74% to meet that the organizational goal. And it will also contribute to the overall clinic's percentage. Right now I said it was at 79. It could increase it to 100%, and that will be good. Something that worked well for me was my preceptor from day one. He worked to supply me with the tools that I needed to complete my project. So by the end of the day, I had just about everything I needed to get started on my project and almost complete my project. That was really good because it allowed me time to focus on other things in the clinic when I came in for the day. Something that I learned while doing this practicum is that COVID has caused a gap in patient care. Before COVID, patients were able to come into the clinic. They were able to, even if they weren't able to see their doctor, they were able to see the nurse, and they got teaching on how to take their blood pressure. They got a new blood pressure cuff. They went over their medications. The nurses went over specifically how to take the medication and the dosages, and making sure they were taking the right dosages. And they even had access to the pharmacists who played a part in managing medications as a whole. They were even they even had access to the dietitian who helped them manage their diet to stay away from foods that contribute to hypertension. So they had a lot of access, being, you know, with face-to-face. Post-COVID, face-to-face visits are down to 50%. And what that means for this particular clinic is each provider is only seeing six face-to-face visits a day, and versus 13 and 15 face-to-face patients a day. That is supposed to increase in June to 75%, so that'll be good for patient care. Something that I would have changed while doing this is when I did the presentation, I would have incorporated all the RNs and the LPNs from each team, because those are the people who will be educating the patients. The RNs and the LPNs will be the ones who set up the VVC, and they will be addressing barriers and things like that. So I would have included all the RN and LPNs from each team, but unfortunately only had access to one team member, and that's because they were working short. By the time I got there, they were down 2 nurses, and I think they were down 1 LPN. So something that I learned through the process is being in leadership allows you to view things differently. You can see things from a different perspective. As a nurse on an acute unit, I would have never saw this project in this way, in this manner. So being able to do this, it not only allowed me to see it from that point of view, but it allowed me to be able to change my practice and what I do on a daily basis. And that is like, I'm going to pay more attention to the processes of patient care, or what it takes to do patient care. And I'm going to try to identify when those processes are in place and when they're not, and the effect of patient care when those processes are in place versus when they're not in place. It could help me manage patient care a little bit better, and it could help me contribute to some of those things that we lack in some of those areas. So with that being said, I'm going to conclude my Share It project, and thank you so much for listening. And to those who are graduating this year, congratulations and have a good year. Bye-bye.